Good morning, everyone. Welcome to today's briefing session. As you join, please go ahead and drop your name and organization or county in the chat so we'll have an idea of where you're from and what organization you're representing. My name is Tanae Franklin. I'm the Chief Strategy Officer for the Tennessee Justice Center, and we will get started in just a moment. This briefing will be recorded and we will make it available with a slide deck to follow along. We'll make that available later on today. This recording and slides will be emailed to registered participants only. We're not going to talk the whole time. We're going to also hear from you all with regards to questions, the questions and answer session. So get your questions ready. Towards the latter half of the call, we'll open it up for Q&A. And again, as you come on, please introduce yourself by putting your name in the chat. Today we have two of my colleagues here, experts on Medicaid, all things Medicaid and SNAP, Gordon Bonneman and Jane Demwobi. And so you're going to hear from them, but I'd like to go ahead and start. Before I get started, let me just tell you a little about who we are. The Tennessee Justice Center is a nonprofit, tax-exempt organization. We are nonpartisan and we are not political. The clients that we serve and the partners with whom we work represent the state's diversity of political affiliation, and our political analysis relates solely to the defense of health and our nutrition programs, and it does not imply endorsement or disapproval of any party or person. In summary, we are here for you, and we are here for the individuals that you all serve in your networks, regardless of background. And that's what makes being at TJC's beautiful, is that we're all in this together. So before we jump in with the speakers, I just wanted to remind you and just sort of bring you all up to date with where we are today on June 18th. So as you probably have heard, the Senate has come back with their markup of what is called the mega bill, otherwise known as the Big Beautiful Bill. And what we know about the Senate markup of the bill, where last week going into this process with the Senate, we knew that 11 million people would be impacted, left off of the Medicaid rolls. And for instance, now we know it's upwards of 16 million. We also know that once people understand the ramifications of the cuts to Medicaid and SNAP in this mega bill, that they raise their hand and say, no, that's not something that we want, and they oppose it. So we have to continue to get the word out. And what we also know is that right now our target for our actions in terms of phone calls and emails remains to be the Senate. Right now, we anticipate that the Senate will try to have a vote within the next week. The goal is ultimately to pass this mega bill before the July 4th recess. But right now is one step at a time, and we're still focused on the Senate. There are some Republicans that and others that are strongly, they disagree with how to proceed. And so it's not over yet with the Senate. So we're still trying to focus on making sure that our voices are heard. The Senate committees, they revised the bill. And now where we thought that the bill would be more palatable, we actually know that it goes further in cuts. And we're going to hear from Gordon and Jane about that. And so we'll be able to understand how we need to message this as we continue to engage with our colleagues in the state and also with our elected officials in the Senate. That being said, I'm going to turn it over to you, Gordon, to get started right now on Medicaid. Gordon, you're up.
Thanks so much, Tanae, and thank you all for joining us again. I know that it's been a long several months, and it's been fraught, intense, and it's only gotten more so as we approach the finish line. Just to give you sort of the high level view, as Tanae was saying, the Senate bill is actually worse in terms of its impact on Medicaid. We don't have Congressional Budget Office or CBO, that's the nonpartisan scorekeeper that does estimates of impacts for Congress. It's a branch of Congress, or it staffs Congress. We have their estimates on the House bill. We don't have their estimates of the financial and enrollment impacts on the Senate amendments that just came out a couple of days ago. And we may not get those before next week when the vote is anticipated. But we know it's bad enough just in terms of the House version. The estimate was that it would cut $1 trillion in Medicaid funding over the next 10 years. When you add in the impact that would have on the knock-on effect in terms of reducing matching state funds, the impact is 1.3 trillion in reduction in Medicaid funding, state and federal. The House version was expected to cut 11 million people off of health coverage, 7.8 million from Medicaid, and another 3.2 million as a result of changes to the Affordable Care Act and failure to continue to extend the expiring premium tax credits for buying coverage through the Affordable Care Act. As Tanae said, current estimates are that under the Senate version, probably the numbers of people losing coverage would rise to 16 million. It's a lot of people in any event. And I think the big takeaway from the Senate version in terms of its impact in Tennessee, because some of the bad things that it did to Medicaid are targeted at Medicaid expansion states, which sadly we're one of the 10 states that did not expand Medicaid. So some of the things that you'll be reading about in the headlines sort of do not directly affect us. There's plenty that still does, though, and which we can discuss. I think the big takeaway for me was that the Senate version really makes clear that the intent of Congress is to repeal the ACA, but to do it surreptitiously. 8 years ago, there was a big frontal assault, repeal the Obamacare, and that failed. But now I think the attempt is to do it much more cleverly, much more subtly. If you look at the technical changes to what it will take to get and keep and pay for coverage under the Affordable Care Act, buying coverage through the marketplace, and what the extent of that coverage will be, you will see that folks will be paying a lot more to get a lot less, and the paperwork and complexities will be much greater. So it really is sort of death by 1,000 cuts rather than one sort of single swipe of the blade. The dynamic in the Senate was that the Senate wanted more cuts. You'll recall that Elon Musk a couple of weeks ago was all in the headlines condemning the bill as an abomination because it would have added $2.4 trillion to the national debt because of the big tax cuts. And so that created a lot of pressure in the Senate to deepen the cuts in the health and nutrition programs, which happened, but not nearly enough to offset the huge impact of the tax cuts. And the Congressional Budget Office has now revised its estimate upwards to say that the impact on the deficit will be 3.3 trillion, which creates more pressure to make more cuts to Medicaid. And there are still negotiations going on, so it's not over yet. Just to mention a couple of other things we mentioned before, but to understand that it's not just about dollars and it's not just about disenrollments or loss of coverage, that really the health impacts are going to be felt by everybody. By cutting revenues to safety net hospitals, including in our state, 9 hospitals that have been identified as being at risk of closing. It really is going to add to the erosion of the healthcare infrastructure that everybody relies on, whether they're on Medicaid or not. If you are in a community that loses its only hospital, it doesn't make any difference what your insurance is. You're going to feel that. It undermines the development of drugs for orphan illnesses that had encouraged pharmaceutical industry to do research into cures for illnesses that are quite serious, but they don't have enough people suffering from them for it to be profitable to develop medications that will address them. We did have a policy of encouraging that important research. That's going away. The president had talked in terms of getting the savings by reducing Medicaid drug prices, which is widely popular across partisan lines. But again, that did not happen. The CBO estimates of loss of coverage in Tennessee would be that 110,000 will lose coverage as a result of changes to Medicaid and the Affordable Care Act, and that rises to $290,000 if the tax credits are not extended. So we're talking about a big impact here. And that's still the situation. Again, just to remind you that we're one of 10 states that has not expanded Medicaid, and the bill in the Senate amendments really double down on going after states that have expanded Medicaid and foreclosing the opportunity for non-expansion states to expand coverage in the future. Sadly, the financial incentives that they've created for healthcare providers to oppose expansion and the penalties that are imposed if the state does expand all but kill the prospects for expanding coverage to the 300,000 people that we know would be eligible and that Governor Haslam tried unsuccessfully to cover through his Insure Tennessee plan.
Thank you, Gordon. We're going to switch gears and talk about SNAP. And, you know, I know we talk about SNAP and Medicaid together, but because they go hand in hand, they impact the same population, and both together sort of are the safety net for individuals in terms of being able to have optimal health. So Jane, what do we need to know, updates about the impact of the impact of SNAP cuts in the mega bill?
Yeah, so I'm happy to talk a little bit about SNAP. When Signe, who's our Senior Director of Nutrition Advocacy, joined the call last week, she was reporting on what were essentially whispers about what the Senate Agricultural Committee's version of SNAP amendments would be. So since then, we do have some confirmation of what policies or what's set forth in the Senate bill. So I'll be adding a little bit of color to what we heard last week. The big picture is that it's not looking good for SNAP. There is a lot of there are a lot of portions of the Senate version that are going to make it more difficult for states to administer SNAP. And in a state like Tennessee, that's already struggling to administer the program fairly to all the people who need it the most, we're seriously concerned about what burdens will look like for Tennessee. So we're in a position in assessing the proposed SNAP cuts. This is looking like the largest SNAP cut in history. There's a prediction that 3.5 million people nationwide would lose SNAP. So to add some color to that, in Tennessee, there are approximately 700,000 people that rely on SNAP. And we can expect that a significant portion of that group would be affected. The House bill cut $300 billion from the SNAP program, and the Senate bill is looking to cut something like $211 billion from the SNAP program. So that's a decrease. The Senate version is a decrease in the amount of funding cuts, but still a significant chunk of the the federal program's overall budget. So yeah, the reality is that both bills would drastically limit the program in significant ways that we have been hammering on, but I can give some more detail about today. So the first is that there would be a major cost shift from the federal government to the states. So in terms of the SNAP funding, it's funded primarily by the feds and partly by the state. It would just put more of a financial burden on the states. We know for a fact, because of SNAP's critical impact on children and access for children to receive nutritious food, there's a chance that it's going to take food away from 2 million children. It takes food away from seniors, from veterans, and from the critical populations that, like Tanae alluded to, really rely on the program. So the official details were released last week on June 11th, actually after our call. And like I said, there are slight deviations, but there are parts of the Senate bill that are worse for some of the populations that rely on SNAP the most. So I'll be talking about the flexibilities that veterans will lose, the flexibility that individuals, houseless individuals and children are going to lose, and the flexibilities that those aging out of foster care are going to lose. So the first thing to talk about for the Senate version is work requirements. So what we're going to see under the Senate version, what we would see on the Senate version, is that families with children aged 10 to 18 are required to complete some work or community engagement activity. So seniors who are 55 to 65 years old are also included within that work requirement. So that means that if you are required to work a certain number of hours to receive SNAP, and it doesn't matter if you can't work because you are providing childcare. If you have to work under these requirements, you're in a position to probably pay for childcare that's more expensive in most areas here in Tennessee. It doesn't matter if you live in an area where there aren't available jobs or complying community engagement activities, you're still forced to follow those work requirements. And it doesn't matter if you don't make a lot from working, you still have to devote your time to doing that if you want to keep the SNAP benefit. So where we were in a position to pull back SNAP work requirements because we know, and the research shows, that they don't work. There are now increased restrictions on people's activities, and there is now more pressure to comply with work requirements, or for states to impose work requirements and make it harder for people to get SNAP. There were work requirement exemptions that existed for veterans, for homeless individuals, and for foster care youth. The Senate version repeals those exemptions. So now, again, those populations are now folded into that work requirement. So if they're for families with children from age 10 to 18, you must work. And for seniors age 55 to 65, you must work. If you're a veteran, if you're homeless, if you're aging out of foster care, you must work if you want to receive SNAP. So the bulk of the damage of the SNAP bill, the Senate version of the SNAP bill, which kind of aligns with the House version, is that states are in a position to pay more for SNAP, and the question is whether they will or won't do it. So the state cost share provision in the Senate bill increases the state's administrative costs. So the state of Tennessee, where we would have been on the hook for about 50% of the cost of SNAP, will not have to pay 75%. So that 25% increase is hundreds of millions of dollars in a state where it's not clear where that money would come from. So it requires SNAP to be a political priority. It requires there to be attention on the program, there to be genuine concern for the people impacted by the program. And if all those things aren't present, we're not sure that the state is going to pony up the money that the feds were prior. So that administrative cost burden going from 50 to 75% is a critical loss for many states, and in our case for Tennessee, because we don't know what the state is able to allocate to make up the money that they're losing. There is also a state cost share provision that's focused on error rates. So states have to report payment error rates, which is goes with whether someone is inadequately receiving funds and how our agency here, which is DHS, is tracking that. If our state has a high payment error rate, that increases how much we have to pay for SNAP. So if there are if states are making mistakes in the SNAP program, and trying to fix those mistakes and reporting those, that actually is causing a payment penalty. So if the state administration of SNAP has a high error rate, that is more of a financial burden. So there are these kind of overlapping considerations that are potentially going to increase the cost of SNAP for a state like Tennessee. Another major issue is that the Senate version ends immigrant eligibility for SNAP, which was already very limited. So there is an overall 5-year bar that prevents immigrants from using the SNAP program unless they were a refugee, asylee, a victim of labor, or trafficking. And then in the new version, that limited access for those groups who are recently arriving to the United States and have quite literally no other safety net, that allowance of SNAP benefit is being taken away. So there is now what is essentially a much more restricted immigrant eligibility for SNAP. Another critical part of the SNAP program is SNAP education. So folks get these benefits loaded onto their card, and depending on where they live or what information they have access to, they might not be buying food that is considered the most nutritious for themselves and for their families. The SNAP education program came around to educate folks on how to use their SNAP benefits, which are not, they're not flush with cash, but it's really important that people know that with the money that they have, they can make nutritious choices. That SNAP education program, which was a statewide campaign, is being cut. So we don't know what it's going to look like to inform folks on how they can stretch their SNAP benefits to make sure that they're making informed and healthy choices. And last but not least, I'm going to talk about the actual dollar amount that folks are receiving. So the Senate bill is limiting any future updates to what's called the Thrifty Food Plan, which was a basis that USDA used to calculate SNAP benefits so that it could actually be in lockstep with not only inflation, but the cost of nutritious food. So the Thrifty Food Plan was a way to improve the amount of benefits that folks are getting for SNAP so that they could use it for food and actually afford food. Now that is going to be limited. So there is a limit to how much that benefit amount can go up in future years to match inflation and to match the cost of healthy food, which, as we know, grocery costs are rising. So if the Thrifty Food Plan is limited in its ability to keep us to keep SNAP benefits up to date with those costs, that puts families in jeopardy because they can't stretch the amount that they receive as far. So USDA is going to have limited discretion to adjust those benefit levels as costs go up and as people's household sizes change. And then there's also an impact on summer EBT. So if summer EBT is a program that feeds kids nationwide, it's a federal program that feeds kids while they don't have access to school meals, and that kind of increases the family's burden to feed them those meals that they would have gotten at school, like breakfast and lunch. Summer EBT is tied to SNAP benefit adjustments. The federal funding is tied to SNAP. So if the SNAP benefit adjustments are limited, summer EBT is limited. So we kind of see this reciprocal effect between the two programs. And it just goes to show all of these public benefits and safety net programs are connected. So those are the critical parts of the Senate version that I'd like to break down, and I can talk through certain parts if folks have questions, but that's really what you need to know. But I wanted to cap off with sharing some indirect impacts of the SNAP cuts, which can be summarized as a burden on schools to feed hungry kids. If their parents are kicked off SNAP and they can't receive SNAP for the household, there are more kids going hungry, and schools are going to be the best place for them to get fed. There's going to be more demand on food banks. So food banks are where folks like walk into an organization that's set up to provide canned food, some perishables, whatever families need. But those food banks are facing funding cuts too. So if more people are going to lose SNAP and need food banks, but food banks are losing funding, there's going to become a a need gap that can't be filled by either SNAP or food banks. There's going to be a reduction in overall economic activity. So SNAP is a benefit program that allows folks to shop in stores. That's small businesses, that's grocery stores, that's farmers markets. If there's a decrease in SNAP funding and SNAP availability, that's an economic hit to the state of Tennessee and nationwide. And then there's just an overall impact on food insecurity, which is already an issue here in Tennessee. Tens of thousands of individuals and families are dealing with food insecurity. They don't have access to food. So this is not helping the problem. It's just worsening it. So I'll stop there. That's all I have on the SNAP program. And yeah, happy to discuss more.
Thank you, Jane. Thank you for everyone dropping your questions in the Q&A tab. And thank you for sharing the articles and sharing information with other callers on the call. Before we jump into the questions, I'm going to start with were the ones that came in through registration, and then we're going to get to the other questions. But what I want to start with first is the question that was asked, particularly with regards to we live in a deep red state. And so the question is, are our senators listening to us? I will say this, our senators, we have a process in terms of, we expect our elected officials to take our concerns and our thoughts and incorporate that into the decision-making process. And so whether or not we think they're listening to us, it is our responsibility to keep our foot on the pedal and do what we are supposed to do in our democracy, which is hold our elected officials accountable. And we do that by reaching out to them and telling them that we want to protect Medicaid and SNAP. That being said, I am a practical person. And so where we think our senators may not be listening because they're carrying such a message that is opposite what we're advocating for, the staffers are listening. The staffers are asking for information about the impact. And so it's not just the data, but it's also the stories. So I would suggest as we continue to call and email our senators that we lift up in our comments about the impact. Talk about the differently abled communities. Talk about those that are living with rare genetic conditions that they were born with. Talk about the impacts to families. And so that is my response about, are they listening? Does it make a difference? I believe that we have to keep our foot on the pedal because that is the process. They will also say, if we don't lift up our voices, then they will easily say, well, no one called me. So we're not going to give them that excuse to say that. We're going to keep our foot on the pedal with regards to engaging our elected officials. So Gordon, I'm coming to you right now. And we've gone through a lot of this information and it can be overwhelming. But what do we say to individuals about how when people are asking how Medicaid recipients will be affected? And I'm going to add to that, and I don't think we've talked a lot about this, what does this have on our foster system, our system for fostering children, and that might be on Medicaid? So if you can sort of take both of those questions and incorporate into your answer, that would be great.
Sure, Tanae. And first, I just want to make a larger point that negotiations are still going on in the Senate. And as I mentioned, the new CBO estimate that the contribution of the deficit is not 2.4 trillion, but 3.3 trillion means that there's a lot of pressure to up the cuts to these programs that meet basic needs in order to offset the impact of the tax cuts. So everything we say is contingent upon how those negotiations go. I don't think there will be dramatic changes to the Senate, but we just have to raise that. And just one more point, which is to the sort of existential despair that some of us feel when we look at our delegation and their public statements about the bill. I just want to add that the measure of our success is more than just whether they vote for it or against it. It's what they say to the leadership. It's the that is trying to decide what compromises to make. And I really think at this point, the big ask I would make is to do anything you can to raise public awareness. I want to just take just a moment, and if I may, Tanae, I'll come back to your questions, but I think it's worth dwelling on a new KFF poll and I'm just reading from the news release. The KFF is the Kaiser Family Foundation. It's sort of the gold standard for health policy and health data in the country. I mean, people across the political spectrum rely on what they on their data and their research. And 2 days ago, they issued a press release announcing a new poll that shows as the public learns more, support for the One Big Beautiful Bill Act drops, even among MAGA voters. The public views the One Big Beautiful Bill unfavorably by nearly 2-to-1 margin. Democrats, independents, and non-MAGA Republicans oppose it, while MAGA supporters favor it. But even among the MAGA supporters, favorability erodes when people hear about possible health impacts. And in kind of in tandem with the rising unpopularity of the mega bill is polling data that shows the popularity of Medicaid and the ACA are at record highs. 83% of Americans view Medicaid favorably. 66% have a favorable view of the Affordable Care Act. So anything that we can say or do publicly to raise that awareness is going to have an effect. If the bill is slowed down even briefly, more of the opposition rises, and it becomes more difficult for members in swing states. And we are not a swing state, we are a red state. But if we can add to the noise level, it just gets out there and makes movable members of both the House and the Senate more anxious and gives them more fodder to try to either influence the bills in a positive direction if it does pass, or possibly cause it to stop and serious reconsideration of these issues. So I just want to say these efforts are making a difference, and we are encouraged by our national colleagues to just keep it up, even in some cases, they would say, particularly in red states. So back to your question that you asked about an hour ago. Sorry, Tanae. And now I'm afraid I don't even remember it. I apologize.
That's okay. Just thinking about just putting it where the goats can get it. I used to listen to Joe Madison, and that's a term that I used from him. What's going to happen to people on Medicaid? And something that we haven't really talked about on our briefings is what happens to the foster care population.
Well, first, I'll answer those in reverse orders. And I prefer the metaphor, put the cookies on a shelf low enough that I can reach them. But I get it. It's same thing either way. For the foster kids, they all get their coverage through Medicaid. And they also get their coverage under the Affordable Care Act until age 26 when they age out of the foster care system, which is important because most, when they leave the system, are very poor. They're socially dislocated. They don't have a lot of support. And the findings were that without that provision, they would likely go without health coverage. And many children in the foster care system have significant health problems. They almost all have experienced childhood trauma, and they have pretty serious health needs that remain unmet when they leave the foster care system. So that coverage is not directly implicated. However, the funding of Medicaid is in significant ways, and this implicates your first question about what will be the impact on people on Medicaid. if you pull the $1.3 trillion of funding out of the program, as CBO estimates would suggest will happen when you take out $1 trillion of federal funding and add to that the knock-on effect of another 300 billion in state funding, you will affect everybody in the program. And to say that this will not affect children, it will not affect the elderly, it will not affect people who are disabled. No, I'm sorry. The CBO estimates, which are nonpartisan, it's the Congress's own technical staff that come up with those estimates, just irrefutably establishes that everybody's going to feel this. How will it be felt? I mean, we're looking at provisions, some of which take effect in a few months, some of which take effect a year or two out after the midterm elections next year, so that the voters will not have experienced the impact when they go to the polls. It's hard to anticipate all of that. It's just to say this will be a disaster. That's not an exaggeration. Will it affect literally every single Medicaid beneficiary? No, particularly those that don't have health problems. I mean, the issue with all health insurance is it all works well until you get sick, and that's when you find out how good it is, what it covers, and whether you can rely on it. So all of those groups, if not literally every individual, all of the groups that rely on Medicaid, half the children in the state, half the pregnant women in the state, 2/3 of the people nearly in nursing homes or receiving home community services, people with disabilities, they all have reason to be afraid. And we're not fear mongering here. That's just what the experts say, and the numbers make it inevitable. Long story short, foster kids will have a hard time keeping their coverage, I believe, because the increasing the red tape is the way that a lot of these savings are to be achieved. And those kids are former foster kids. Many of them are not in a great place to be able to navigate an increasingly burdensome trap of red tape. So I think a lot of them will lose their coverage. We already see that. It is establishing eligibility in that group. It is supposed to be automatic, but because of deficiencies in our Department of Children's Services and in TennCare, as a practical matter, it's already a problem.
Thanks, Gordon. So Jane, I'm coming to you with a different question. We're talking about Medicaid and SNAP together. We know that nutrition is critical, even with those that have chronic conditions, cancer, and we know that nutrition is critical. So we're going to talk about the impact to those populations in a moment, but where people actually go to receive care, particularly in our rural hospitals. I know that you are kind of the person here at TJC that keeps an idea of like which hospitals are closing. One, do we have the most recent up-to-date information about hospital closures in what areas of the state? And if there's anything that you can share off the top of your head, that would be helpful. And I think we also might have something on the website. So talk to us about what you know about hospital closures in 2025. Where are we? What's the status?
Yeah, so one just like background is the operations of hospitals, their ability to have the revenue to actually serve the people that walk through those doors is tied to Medicaid in particular, because Medicaid is a reimbursement program. So for those who aren't aware, the hospitals will bill the state Medicaid program, TennCare, to be reimbursed for the services. So a decrease in TennCare funding, a decrease in Medicaid funding means that the hospitals have less money. That's less money to accept patients, that's less money to provide quality service. And that is the trend that we've seen here in Tennessee. So a helpful way to understand the burden of losing Medicaid funds on rural hospitals is actually the Medicaid expansion or the lack of Medicaid expansion here in Tennessee. So studies have shown that states that did not expand Medicaid are 6 times more likely to have hospitals close, especially rural hospitals. So this has been documented that the influx of Medicaid dollars helps hospitals stay open. We didn't get those dollars. So the trend in Tennessee is that in the last 10-ish years since the Medicaid expansion option has been available, 9 hospitals have closed in rural areas. And that's 9 areas where there was a broad healthcare service, and that doesn't exist anymore. So to Gordon's point, and to your point today, that's just an increased burden on the community. That means you have to drive maybe out of your county to receive medical care. And imagine if that happens in an emergency. So we already have the data that 9 hospitals have closed in the last 10 years, and 4 have actually been converted to extremely limited services. So instead of being a full service operation, they only provide maybe just emergency care or limited maternal care and things like that. So the trend has been a decrease in the availability of hospitals in rural areas. And as of the most recent data about hospitals in Tennessee, there are 9 that are in danger of closing, which means that their revenues are in the red. So we can't say specifically how much in Medicaid dollars each particular hospital is receiving, but we know that compared to other states that did get an influx of Medicaid funding, Tennessee was not able to keep its rural hospitals open. So it calls into question how stable these healthcare centers are, or these hospitals and healthcare centers are across the state if we are in a position to lose more funding. So the state of rural hospitals is not great. Tennessee has the highest or one of the highest, depending on which year, rate of rural hospital closures. So that's the context of the crisis. That's the context of the need. And we know that the hospitals are already closing or they're limiting their services. And we just, I mean, I can say for TJC and what we see in our clients in rural areas, we don't want that problem to get worse. So that is what we're talking about when we say cuts to Medicaid will impact rural communities. It means that those hospitals have less of a revenue generation option, and that might mean that they close their doors, like has already happened. So that's a context I can provide for today. And I see some people are chiming in the chat. I'm gonna let Gordon add something to that if he wants to, because he has seen this firsthand, the trend in rural hospital closures.
Yeah, and
Thanks,
Gordon,
Jane.
as you answer that, Gordon, also loop in what you know about assisted living and also caregiving agencies, home health care.
Yeah, thanks. Actually, the Shep Center at the University of North Carolina, Chapel Hill is considered the go-to resource on this, and they just put out a report that the Senate bill could be expected, or maybe it was the House bill. Either way, because they both have basically the same realm of cuts. Could be expected to close 300 something hospitals, and they identified 9 in Tennessee, but they did not list them by name because they didn't want to. And I think the reason for that, we know from experience, because we have done the analyses and listed, is that the hospitals get upset and say, well, you're going to make it a self-fulfilling prophecy because people will, our doctors will leave and patients will leave and so forth if they think we're going to close. We actually have a resource, an information resource in Tennessee that enables us to figure out who has been not just losing money this year or last year, but over the past 2 or 3 years, which is the standard that the Shep Center uses and that we've used. And we can do the analysis to figure out what the 9 hospitals are. But I think the short version of this is it will accelerate the creation, or I should say, in some parts of the states, expansion of healthcare deserts. There are swaths of West Tennessee and parts of the upper Cumberland area and East Tennessee along the Kentucky line that are already hospital deserts. And it's not just hospitals, to the question, Tanae, about assisted living or nursing facilities. When you lose a hospital, we know 2 things. First, you lose either the first or the second largest, depending on the size of the school system, employer in a county. if it's a rural county. And those are not just any jobs, those are jobs that range from entry-level custodial positions that are accessible to a lot of folks with limited skills, up to surgeons, and who bring a lot of money into the local economy. And when you lose the hospital, then nurses, care aides tend to move away. That makes it difficult to staff nursing facilities, home nursing services. You lose the pharmacy. It sets up a whole domino effect. And ultimately, that domino effect reaches out to the larger economy. Young people don't want to stay in a community where there's no opportunity. People don't want to retire to communities where they don't have access to good health care. And new businesses don't want to relocate to a community where there's not adequate health care. So the effect really is transformative in a negative way. And that's why we have spent so much time talking about rural health, which is really going to be set back by this. We don't have the same numbers for nursing homes that we do for hospitals, but it is definitely a crisis. And I just want to add that the bill, in terms of long-term care, it does away with the SHIP counseling program, which provides counseling for Medicare beneficiaries to navigate what can often be a daunting program in terms of getting care and getting coverage, which is just gratuitous. There's no real savings there, but it's a program that costs little and helps a lot. The other impact is that it does away with minimum staffing standards for nursing facilities, which has a huge impact on quality and even safety, and has been fought for by nursing home advocates for years, and this wipes that out. And it's just one of those examples amid all of the headlines about trillions and billions and millions of people losing their coverage. It's that nitty-gritty sort of thing of like doing away with nursing standards that it is going to affect a lot of people and is not getting the headlines.
Yeah, thank you, Gordon.
Real
Jane,
quickly.
oh, go ahead.
Yeah, I just saw a chat, someone put in the chat, an observation that when we talk about the limited services some of these rural areas are forced to provide because of the loss of revenue. So a hospital that does everything having to tailor its services, it's often not profitable for them to provide maternal care. So when Gordon talks about rural healthcare deserts, that's a problem across the state, but you can actually also look specifically at the expansion of maternal care deserts, which is also tied to the rural hospital closures. So I really appreciate someone putting that comment in because there are rural areas where there's simply no maternal care available for pregnant people. And so you have someone having to drive, 40 plus miles just to get basic health care during their pregnancy. And so that is a really, really severe problem here in Tennessee. It's folded into the rural healthcare crisis, but I appreciated that and I wanted to spotlight it as well so folks understand that distinction.
Yeah,
And Tony Gar has asked, can we get the names of the 9 hospitals? And Jane, can I put you on the spot and ask if we can, I can show you where to find the data and we can sort it out and share that with folks.
yeah,
Absolutely. I think that'd be good.
There's also been a request to apparently there's a difficulty saving the chat. And so if that's not possible, we'll try to get that out to folks.
Yeah, we're pulling down some of the links. We're saving the links of information that's being shared, also documenting the questions. This is really helpful. And so the reason that we are here every Wednesday is to make sure that we share with you all what we know about what's going on with the changes. We also learn from each other. But going back to the top of the call, when we are talking about once people understand what's at stake, then they are quick to say, no, I want no part of that. And so our goal, in addition to contacting our elected officials, because that's what we're supposed to do, and we might be checking a box, but we are following through on our our responsibility as residents of Tennessee. We also have to share this information with our networks. That means with your fraternities, with your sororities, with your faith communities, with your colleagues, your neighbors, your family members. I'm not asking you to have that uncomfortable political conversation. But what we do know is that we can only amplify this message if we all do this together. So that again is our call to action, is to make sure that we share this information on a regular basis. You're following us on social media, hopefully. Also, the Tennessee Justice tennesseejustice.org/join us page. We have information there. And then also in the information that you received from us at the end of the call every week. Jane talked to us about the impact on children and children being hungry. How many children are going to be impacted in Tennessee? Remind us those numbers, and also talk to us about what that means for learning in our state, K through 12.
Yeah, so the data that 2 million children are likely impacted by the Senate version of the bill, or actually, sorry, that analysis was based on the House version of the bill and came from CBO. We had noted that because the particularly the work requirements and the exemptions that are pulled back are impacting households with children. So we have data on who's enrolled on SNAP at the national level and what the age breakdown is of those SNAP households. So we know that if the obstructions that I talked about earlier around particularly work requirements, even the very few immigrant groups that were receiving SNAP, if that's stripped away, and some of the other things I mentioned, if those are imposed, households households with 2 million children, that's nationwide, will be impacted by SNAP. So just to echo something Gordon said, when we're presenting this information, we don't know that every single person on the program is going to be impacted. The 2 million number is referring to the number of households that have the number of children that are in households that are facing some kind of change as a result of any of the proposed impacts of the Senate bill. So we don't know what that number looks like specifically in Tennessee because, again, that analysis just hasn't been done quite yet. But we know that there are in Tennessee, 50% of SNAP households have children. So if we do a little bit of math here, there are about 700,000 households or 700,000 individuals using SNAP. And that's about 400,000 households. Half of those households have children. So we're looking at something like 200,000 households that are impacted by some of these changes because they're making it difficult for the adult in the household to keep SNAP. If the adult can't keep SNAP, that affects a child, their ability to feed their children. So that's kind of the logical steps that we're following to deduce the impacts on different communities and highlighting children. So that 2 million number should grab our attention, and it should make us really think about who is relying on SNAP the most, which is largely kids. And then as we learn more information, as there are more analyses done, we can know specific impacts on Tennessee. But I think if you want just like a broad understanding, the data we know is that 50% of households here in Tennessee have that are on SNAP have children in them. That's around 200,000 households. So we really want to make sure that we don't have hundreds of thousands of children who aren't being fed and going hungry, whether they're in school or just trying to have a good summer. And to your point, Tanae, about the impact on kids, hunger is a distraction. Hunger is the reason that kids can't focus in schools. It's the reason that they aren't able to take part in physical activities. Hunger and broadly food insecurity is a major problem in Tennessee and in a child's life because not only are we looking at nutritional deficiencies in terms of not getting the right food you need to grow in those critical years of life. But it also is tied to worse health and community outcomes. It's tied to just overall a lower quality of life. So hunger is we could talk practically about how hunger makes kids perform worse in schools, makes them feel less safe, less happy, less well. But it really is an overall detractor in the quality of life of a child at a critical time. So the impact on kids is dire, and I think it's important to keep highlighting that as we learn more information. Thanks today. You're muted.
Thank you. Last question before we close out with our final comments and then our call to action. Jane, you mentioned in your remarks earlier that food shelters are also being impacted. There's a question about Meals on Wheels. So these are systems in which we supplement the food because there's already not enough. Can you talk about the impact on funding to these entities? What do we know how with regards to how they're impacted with federal funding cuts?
Yeah, so the analysis from our national partners has not indicated that Meals on Wheels is affected by the budget cuts. So it's left out of the Senate and House bills. However, to the extent that Meals on Wheels, which I believe we have a Mid-Cumberland's Meals on Wheels and some other regional groups that are executing the purpose of Meals on Wheels in different to serve their particular regions. To the extent that some of that funding is coming from the state, this is where we go back to there's now states are facing a significant financial burden, basically a financial hole in the SNAP program. And they need to figure out whether they're going to fill it, how they're going to fill it. So I would say it's helpful to think, and Gordon can let me know what he thinks about this. But I think it's fair to say that the state budget is in crisis. Like there's a chance that we're looking at unprecedented levels of revenue loss across the programs. So that can affect anyone and anything. So even though Meals on Wheels is not mentioned in the bill, we just don't know what the funding sources are for some of these programs and what they'll look like in the next couple of years. So that's what I'll say. I think it's helpful that it's not mentioned, but I don't think we can say for sure that it won't be impacted. So there's a bit of tension there.
That's helpful. Thank you. Gordon, what is
Yeah.
your take-home message for Medicaid for the members on the call?
Well, I would just say to follow on Jane's point that the knock-on effects of all of this, like on the education part of the state budget, I mean, you take 1.5 to 2 billion, which is our estimate of what's at stake here, out of the budget, you're beginning to have an impact on every other part of the budget potentially. And K through 12 is the largest segment of the budget, so the one most at risk. And there's a quote that I just want to cite because I think I read an article where someone with a nutrition with a food bank made the point that reducing SNAP by 11%, and they're talking about potentially much more than that, would be the equivalent of wiping out every food bank in the United States. So it's very grave. Again, my pitch would be if you've already been calling, try to think of somebody you have not already put the touch on to get them to call your House member and your senator. But also, please, if you have an opportunity to write a letter to the local newspaper or call into a radio call show, raising the public awareness of this is really, again, the polling shows that this messaging is working. And if this gets slowed down for a little bit, then the effort at the federal level to make these huge cuts will unravel. So this is a real white knuckle nail biter conclusion that we're rushing towards, and we just need to keep leaning into it.
Thank you. Jane, last comment before we close out.
Yeah, I just wanted to beat the drum that your work is working. Our work is working. People are paying attention where they weren't before. We've had successful press conferences, press calls, interviews, and we've really we've been getting the word out, and we hope that you all will continue to. I will personally say, I gave a presentation to the Sumner County, a local group in Sumner County, NAACP, and they really appreciate this information. So if you have a group of folks that want to learn more, reach out to us. We'll take some time outside of our Wednesday to talk to them and bring them up to speed. And we see that that makes a difference. And I just hope that we can continue to do that together. So thank you all for continuing to join us. And yeah, we're willing to work.
So what do you do? Again, lift this up with your networks. If you don't feel comfortable having that conversation, follow us on social media and share that social media post with them so they can get more information. Let people know when you lift up your voices, let folks know that you are doing this on behalf of the voices that cannot or are not able to speak on their help on their own. This is going to impact our low-income communities across Tennessee, regardless of political affiliation, regardless of race, regardless of gender, regardless of age. We're all in this together. Share your stories. It's not just about data, it's also about impact. Keep contacting your senators. Don't let up. Their staffers are listening. Talk to the media. Like Gordon said, if you can write an op-ed letter, if you have an opportunity to engage with media, if they ask you questions, if you're at community forums, please lift up your voice. And then again, follow our TennesseeJustice.org Join Us page and social media for just-in-time information. Thank you for joining us, and we will see you next Wednesday.